go, 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 go. That's the birthday. That's the birthday.
Ho, what's up, Z-Pack? Welcome back to Studio Z. It's your boy, Dr. Zubin, a.k.a. Z-Dog MD. And you know what? We're so excited today because we have a guest who y'all know and love if you watch the show. She is a physical med and rehab specialist who subspecialized in pain management. Pain, will you return it? I'll say it again. Kathy T.
What's up?
Dr. Kathy Travnicek.
What's up with my Reynolds? You can see it in the camera.
We keep the studio so cold. Let's show this camera right here. We keep it so cold that we triggered Kathy's Raynaud syndrome, and the tips of her fingers are ready to necrose.
Yes.
Do we care? No, because we take it for the team in this place.
Yeah, I'll be fine.
Yeah,
Be fine.
I mean, digits are not 100% necessary to practice your craft,
That's true.
except the craft we're going to talk about today, which is putting holes in people.
Yeah, that's right.
Yes, so this is what we want to talk about today, guys. So Kathy being a pain specialist here in Las Vegas, now there's been a ton of talk lately and news lately, and we've been talking about it on the show, about pain specialists in particular, but anybody on the front lines in being in danger in healthcare because, partially and largely because of the opioid epidemic. So people who aren't getting the narcotics they think they need, they're either addicted or dependent or what have you, and when they have an interaction with their pain specialist that isn't to their liking, meaning it didn't result in an immediate prescription for that thing that starts with a D, they are coming back with a gun. So there was the gentleman in South Bend, Indiana. Did someone die back there? What happened?
That's our intern,
We're not
Ken.
supposed to look here.
We got an intern.
He's messing things up, see.
This is what happens. You get a medical student, okay? You let them in the house to watch the show, and immediately they're like fumbling the retractor. You know, it's like, whoops, there goes the anesthesia drape. We're not hierarchical here. We just don't like medical students. Is that what it is? No, we love them. We love them. Welcome, my brother.
I can't speak.
Yeah, you're gonna stay mum on this.
Yeah.
So the doc, he was a PM&R guy, I
Yep.
think, in South Bend, Indiana, whose patient's husband came back to the parking lot, was very agitated, and shot him, and then shot himself later. We had Dr. Neville Campbell's office here in town. Do you know Dr. Campbell at all?
I've met him a few times, but I don't actually know him.
Got you. So Neville Campbell's office, a disgruntled patient who didn't get what he wanted, came into the office, shot I think a couple of the staff, but they were okay overall, and then shot himself in the lobby, and Neville had to bolt up and barricade himself in an office with some other people, and it was just horrifying, at least to look at the Facebook.
Yeah.
So immediately I thought about you, Kathy, and I think we exchanged some emails, and when these kind of things happen, the first tendency is to go, the sky is falling, doom and gloom.
Oh, freak out session. I mean, I freaked out for a day or so. I had a lot of anxiety, and I thought, this is it. I need to protect my staff. I need to protect myself. And I was thinking of all the ways that I could do that. And so we went through with our staff, how to de-escalate situations. I went and got my carry conceal.
You got your carry conceal?
I did.
Wow.
I did. I'm just waiting to go down to the police station, take my picture. I need to get my hair and makeup done before I do that. So obviously I didn't do it today.
It's like a Bonnie and Clyde
Yeah,
sort of
I
look
need
that
to
you're
get
going
it.
for.
Yeah, exactly.
Yeah, you want to
exactly.
look,
I need to look good.
pretty strapped.
Yeah.
So let me understand. So, were you interested in having a concealed weapon prior to this, or was this just something that happened after all this news came out?
I had actually thought about it for a while, and it wasn't even really related to pain management because I don't feel unsafe in my job. I grew up around guns. I grew up on a farm. I shot rifles at 13, and then I had shot machine guns, and yeah. So I had done a lot of shooting before, and so I had wanted to get a carry conceal and get a pistol.
Got it.
And then when the shootings happened, even though it's really rare, I wanted to be prepared in case that would ever happen. And even when you get your carry concealed, the instructors will tell you, look, this is not a license, you're not a police officer, you're not in the military, your job isn't to just go into a situation and get involved. If you can get out, leave. So if there is someone who would come into the office and shoot, I wouldn't actually go purposely towards them. If it would be if they came to me, because that's what the laws are. That's how you're protected. Yeah.
In Nevada anyways. And
yeah.
So it's interesting. So, after all this stuff, it didn't really initially, I know you were concerned.
I was scared, yeah.
Yeah, because
Yeah.
we exchanged some emails.
Yeah,
And I have a neighbor who's a pain doc as well, and I talked to him the other day, and I made a joke. He said, because we had met for the first time, and he just moved into the neighborhood, and he said, "What do you do?" And I'm like, "It's a long story. It's complicated."
You're like, nothing?
I'm a doctor, but I do this other stuff. But anyways, I'm a I'm a hospitalist.
Yeah.
And he said, "Oh, I'm a anesthesiologist who kind of switched to pain." And I said, "Oh, don't get yourself shot or anything like that." And I was joking, har, har, har. And he looked at me dead serious in the eyes. And he's like, "Yeah, that's the reason we're expanding our office, so we can have a separate employee exit point, so that we have a safe room, and so that we have a space where we can watch all the patients, because this is a serious problem." So I was kind of taken aback a little bit. But he took it very, very seriously. And I think he has a large staff and a lot of security concerns. So the fact that we even have to think about this kind of blows my mind.
I talked to my dad about it, and he said back in the day when he was practicing in the 50s and 60s, you never thought about this. Like, patients didn't shoot physicians. Now, but you always had difficult patients. So mentally ill patients, you had to talk down. You did have to deal with de-escalation, but you know, really the shooting of physicians is more recent. And so he talked about never thinking about this, never having to worry about it.
And my dad's the same way. Like in my dad's day, my dad and my mom shared an office, and she had psychiatric patients, and he had psychiatric patients because he was an internist.
Right.
So they both had psychiatric patients. But my dad, you know, he was 6 foot tall and pretty muscly at that time. And he, if anything ever happened, he would come in and kind of just lay down the smack, meaning, you know, that's all it took. You didn't need a weapon. It usually de-escalated.
Right.
My mom was really good at verbal de-escalation.
Well, she's a psychiatrist.
Yeah.
They're the best.
Oh, yeah,
You want
yeah.
to learn how to de-escalate? Sit with a psychiatrist and stay with them for a while, and you will learn how to de-escalate a situation.
Absolutely.
Yeah.
And it just didn't seem like it was a thing. Now it seems like something is snapped. And I think also there's a perceptual erosion in our level of authority and respect that I think doctors and nurses and healthcare professionals used to have.
Right.
So are you perceiving this on the front lines in your practice? Do you find that patients are much less respectful or a little scarier, or has it not been the case?
Boy, that's a good question. In terms of the 5 years that I've been in practice, I haven't seen that much of a difference. But I haven't been in practice for 20 years. I think that you will always have difficult patients, and I don't think they've become more difficult. I'm probably more confident in dealing with those situations now than I was in the past. And I've had maybe 2 incidences where I felt unsafe, and the patient said that they would come back, they would come get us.
Well, what did you do?
Well, we called the police. Each time, if you ever feel threatened, if you feel unsafe and a patient is threatening to hurt you, you call the police. You get the police involved.
And there's no ifs, ands, or buts. You just do.
No, there's no ifs, ands, or buts.
Yeah. Well,
unless you want them, like you don't really care whether they come
You're
back.
suicidal actively, right?
Yeah.
Did you find that the police doing that, going through those motions, was that helpful?
We felt it was. Now, what they did after they left, I don't really know. I didn't follow up.
Right.
Yeah.
Right. But that patient, did they ever come back? Did
Never
you fire
came back. Never had any problems.
Did you have to actively fire them from the practice, or was it just a?
Ooh, so it was my boss's patient. I don't know what they
so they had a
actually.
protocol.
Yeah. And I've only had to technically fire 2 or 3 patients in the past. I tend not to fire patients.
Yeah.
Unless it's egregious, or something like they don't pay bills.
Right.
The bills aren't paid, or they have multiple no-shows. We had a police officer who was having some issues with sexually harassing some of our staff. So I let him go. And that's kind of scary too, letting a police officer go, because you don't know if they're going to pull you over and that whole situation. So I was nervous about that one. And then the guy who threatened the office threatened to come back. But I haven't seen a lot of threats against my life. I think that situation is rare, but when it happens, it's scary.
Have your staff been threatened at all, directly outside of you?
I don't know.
Yeah,
I don't know. I should ask them. No, they haven't said anything.
Tom, because your wife had a kind of a weird stalker and
yeah, she had this situation where this security
nurse.
guard that was working at the hospital kept coming up to her floor in the NICU where he had no business being and being like, "Hey, I want to talk to."
Oh yeah, you told me about
that
this.
whole thing, and they had to get. Luckily, the administration took care of it, but we were like, we were looking at options for, should we get her a taser? Should I get her pepper
Yep.
spray? Like, she's
Yep.
not into having a gun or
Yep.
anything, but I was like, you gotta have something on you so
Yeah.
that. And I think, do you think that women have to think about violence just like so much more than we as guys could ever even imagine that you do?
Well, speaking from my own experience, I would say yes. All the women in the actually everybody in the office has some form of protection, whether it's a taser or pepper spray or a gun.
Oh, is that
Everybody
right?
does.
Everybody
The
does.
men and the women. Everybody has something. And I don't really know, to be honest.
So you guys have to be honest, like coming from the Bay Area, bastion of liberalism.
Right.
This whole idea of having a gun at work is crazy to me. Like it strikes me as absolutely a sign that the apocalypse is drawing near. Whereas I
But
think
it might be.
And it might be.
Might be.
In which case Logan's strapped. He's strapped
Yeah.
right now.
Yeah.
I'm always strapped.
Logan is
always
always
right
strapped.
That's why if you want to come by our studio audience,
Don't even try
don't
it.
even try it. But come and have fun.
Well, Z, you kind of changed your opinions on gun ownership after listening to Sam Harris's riddle of the gun, didn't you?
Yeah, so my original thoughts on guns were if we could get rid of all of them, we'll all be safer.
But that will never happen.
And that's the catch.
That's a catch.
That's
That
the
will
catch.
never happen.
So
We're past that point.
Explain to me the principle behind that, because that's what convinced me ultimately that what we need is safe gun ownership instead of no gun ownership, because it's not realistic.
Right.
Because what Sam said was, and I agree, and here's a guy, Sam Harris, who's threatened by everybody all the time because
I love Sam Harris.
I love him too.
Yeah.
He doesn't like religion, he doesn't like Islam, he doesn't like Christianity, he doesn't like people who are anti-science, and he is also a spiritual guy, a
Yeah.
meditator.
Yeah.
He wrote a book called Waking Up: A Guide to Spirituality Without Religion. I mean, he's a deep thinker and a philosopher, but he is an expert in marksman, an expert in self-defense and certain martial arts.
Oh,
And
I didn't know that.
Yeah, and part of the reason is that he feels like he needs to defend himself and his family against the many, 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 many crazy people
Right.
who want to kill him, who have said as much, right? So
Right.
for him, his argument is the cat is out of the bag in the US. There's hundreds of millions of guns.
Right.
To get them back is going to be almost impossible. Australia did something like this with I think a buyback and a regulatory program that had some results.
But I think the mentality is different.
Right. It's also a smaller country.
Yes, yeah, much
a little
smaller.
more homogenous. I mean,
Yeah.
it's a very different situation. The U.S. is very different, and it has a long history of gun ownership
Mm-hmm.
and the Second Amendment and all of that. So my feeling is if you're going to have them, let's make everybody who has them trained and safe. Now, the problem, again, is like the gun rights people will say, well, but then only the criminals are going to have guns because you're going to regulate it so much that no one else is going to have guns. I mean, do you have thoughts on that?
Oh, goodness. I mean,
We ask the hard questions here on Incident Report Live.
I think everyone can agree that people who are mentally ill or who really there are some people who have no business having a gun. I mean, I know a few women who have severe anxiety disorders, and they will shoot themselves before they would actually shoot the person that they probably would be meaning to shoot. So there are just some people who
Shouldn't have weapons.
shouldn't have guns.
When you okay, now a couple things I want to say. Australians, I want you to weigh in because I'm seeing some comments about Australia. Weigh in on what your experience has been with gun control in Australia. The Brits have a pretty aggressive gun control, and that's been going on for a long time. But for Australia, it's relatively newer. So weigh in on that. But I wanted to ask you, when you applied for your concealed carry, there were some exclusions, right?
Yes.
Yeah. What were some of those?
So there are a few interesting ones. Any mental health disorder, but you have to report it. And it was mostly if you'd been admitted into a psychiatric hospital and had been treated, which they could find your medical records. But the most interesting one that was highlighted was medical marijuana. So in the state of Nevada, you apply online for your medical marijuana card. It's like $300 or 160 something. And so you're registered with the government, and then you go in and you can get your medical marijuana. However, you cannot have a carry conceal with your medical marijuana license. However, I can prescribe you fentanyl and Fioricet and a benzo, and you can have all of that and have your carry conceal. So where does
something-
that make sense?
Yeah, something's not quite right.
Yeah, no.
Like, if anything, the weed's going to make you mellow,
Yeah, you probably would be less likely to shoot somebody.
unless you're Snoop Dogg.
Yeah.
Actually, he was never convicted, guys.
No.
Murder was the case that they gave me. Dear God, I wonder, can you save me? I can't die. My boo-boo's about to have my baby.
Not me.
No, not this boo-boo. I've had my babies. I'm done. All right. Actually, I need to get my tubes tied. You know what I'm saying? Do you know someone in town who can do that? Because I don't trust any docs in this town except for you.
I'll do it.
All right. You can do a vasectomy?
I can read a book.
Oh, dear God. Will you carry the weapon?
I
while
bet
you
you
do
the
it?
medical student can do a vasectomy. I have the lidocaine. You'll be fine.
Why am I feeling very uncomfortable right now about my my choices? So
Totally off topic.
you got the concealed carry. So going through that now, you have the now. Do you feel like, okay, you're going to have the weapon in the office? Are you going to carry it in your scrubs? Like, you just came from the office. You were running late because
Yeah.
you were seeing patients.
Yeah.
Is this thing going to be like in your back pocket? Like, where are you going to put it?
So there are different holsters you can have. There's one in the front. There's one you can do in the back. And they have like an abdominal one for people that wear scrubs. So I have a physician friend who does pain who wears scrubs, and he has like an abdominal, it's kind of like an abdominal binder where you have the gun there. So he has his gun on him at all times.
Wow.
There's also, you can put it at the ankle. So you have different options. I actually have a purse.
What?
I had to be fashionable with
gun
it. Why
purse.
not? Yeah.
That's right. I can
Yeah.
see you on the runways of Milan.
Yeah.
With the purse. Well, you know, and again, this still, I still am so vaguely uncomfortable with all this. So you're very well trained to use the weapon.
Yes, so I had a friend take me out and we shot guns for hours. I passed my shooting test 100%.
Yeah. And do you feel?
If I failed it miserably, or if I wasn't shooting well, I would not carry.
Do you think that under a emotional, stressful situation, you'd be able to use it as a deterrent, or do you worry about that?
So that's what you have to practice.
Yeah.
So there's different tactical training that like the military will go through, or police officers will go through, where they're under stressful situations. You
Yep.
have to go around a corner. You have to train to shoot that way. So I plan on doing that actually.
As a process?
For fun.
I was going to say.
I don't think it's ever going to happen, but just for fun.
Do you have to do that tuck and roll thing where you roll and then come up like this?
I would like to do that
I think,
because
you know
that's
what?
really cool.
Because then I'm in.
Yeah.
Well, even
Yeah.
Sam Harris talks about this, that there's a guilty pleasure to gun ownership
Yeah.
also.
Yeah.
Like Logan has a small arsenal in his house.
He does.
You know.
Yeah, I'm not surprised.
Very proud of it.
I don't refer to. I don't call Logan's house a house. It's a compound.
Compound.
And
That's right. It's a high
We can
fence
train at
operation.
Logan's
yes,
house.
yes.
In the backyard.
I'm just one day I'm going to read on the news that the compound was under siege and like
Liliana Cook says Logan takes you out on a Saturday and live stream it.
I keep trying
Z,
to.
do
It
you want
won't
to come
come.
shooting with us? We'll live stream
He's a
it.
Hey man,
secret
if we
communist.
I'll tell you what,
Good.
if we can get a gun company to pay for the ammo because it's too expensive, I will go out and I will shoot. Now the thing is, I've been to shooting ranges. I really enjoyed it. Like,
Yeah,
it
it's
was
fun.
a tremendous feeling, and I found that I was actually good at it because it required a certain degree of being able to calm yourself and,
Yep.
and steady and deep breaths, and
Yep.
the way that you squeeze.
Yeah, and not like
and that,
jam it.
The first time I did it, I was like, pop, 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 pop. And,
Oh
and
yeah, that's how I was too.
Even
They're
the
like,
s-
Kathy, chill out.
Chillax.
So they would call me Hammer because I would just like yank the trigger.
right? That's amazing.
So
Kathy
that's
the
my
Hammer.
nickname.
That's pretty awesome. And then how did you improve? You just practice?
I had somebody sit there and just say, nope, nope,
Nope.
nope, nope. I mean, he just watch. Every time I shot, he would watch. And then he would have me do different. He would tell me to do something different. I would just do whatever he said.
Yeah.
Shoot once, shoot twice, shoot 3 times,
Yeah.
turn to the right, shoot that target. So he had multiple targets set up, and so would have me do multiple different shooting.
Now, who knows the answer to this? Is it good to advertise that you're carrying? Or do you really want it to be concealed? Because is it a deterrent?
Well, I don't have it on me all the time.
Right.
And I don't use it. I'm not sure it really is a deterrent.
Right.
I don't. If anybody knows there are any studies on that, that would be good to know. I mean, police officers carry guns all the time. I don't feel like that's a deterrent to crime. I mean, people still.
It depends on, on what it
Yeah,
is.
I'm
And if
not
people are
sure.
suicidal,
Yeah.
like the gentleman in South Bend who was like, I'm going to end up dying doing this, but
Yeah.
I'm going to go out.
Yeah.
And the guy here
Yep.
who ended up killing himself.
I think they said 90%, there was an article I read the other day, 90% of shooters are men. And I think 50% of the time they end up killing themselves or the cops end up killing them.
Right.
Or maybe that's 60%, something like that.
Suicide by cop.
Yeah.
Yeah. Well, so there was an article recently that you had sent to me, workplace violence and active shooter considerations for healthcare workers. And we're going to link to this. Mrs. Dog got me the full article because she's an academic.
We're just losers.
Both me and Kathy were like, can you get me this full article?
Yeah.
She was like, can you get me the full? I'm like, I'll ask Mrs. Dog.
As I took like a photo from my cell phone, can you Get
She
that.
literally sent me, like, I should show you guys the text.
it's
Like,
blurry.
Have you seen this article? It's like a picture of a picture of this article. So this is what happens the longer you get out of residency. It's like, yeah, here's some.
Which is bullshit. We should have access to our
Hello?
all articles free. It shouldn't be $100 for a damn article.
That should have been in the goddamn Constitution, don't you think?
Yeah, this should be in a physician bill
the
of
Third
rights.
Amendment.
We have the right
We have
to
the
all
right
scientific
to
articles.
all, as physicians, we have
Yeah.
the right to all scientific data.
Absolutely.
Because otherwise, how are we supposed to educate ourselves?
Right.
It was such an aggravation to get this article.
Yep.
And this article purports to help us protect ourselves. So are
Right.
we supposed to pay the American Orthopedic Association and the Journal of Bone and Joint Surgery Incorporated,
Yep.
that's a for-profit incorporation,
Yep.
to have this knowledge? Apparently we are.
Yes.
But I won't. So suck it, Bone Organization, or whatever the hell it is. Journal of Bone and Joint Surgery Incorporated.
JBJS.
So there it is. There it is.
Everybody in the comments is saying you never advertise that you're carrying. Concealed means concealed, basically. That's everyone's opinion.
600,000 people know I carry.
Sorry, Logan. And they also know you have a compound, so no one's
I
going to
hate
F
you
with
guys.
you. No one is going to F with you, bro. So this workplace violence article, looking at it, they kind of looked at, first of all, the scope of the problem. And they used words like, well, this was amazing.
It was a little dramatic.
It was a little dramatic for a scientific piece. It says the rate of workplace violence that this report portrays is astounding. Now, I don't remember astounding being the scientific vocabulary. It's one of those more.
But these are probably super old white guys. I'll bet you they're 80, like my dad. And so they never saw this in their early training. So
That's
to
probably true.
them,
This is
they're
astounding.
shocked.
Well, we've got Brian Warren,
defense.
Michael Bossy, and Paul Tornetta, the third. When you're the third, you're
Yeah.
probably at least 75.
Yeah,
I've
I
never
agree.
met someone who's like 30 who's the
Yeah,
third.
nobody does that anymore.
No, it's old school.
Yeah.
So, okay, so we know these guys are old. Now watch, they're all going to message me because everybody watching the
Yeah,
show.
we're gonna get shit
yeah,
on
we
pretty
wrote
soon.
this thing, and I'm a 45-year-old orthopod. And also, screw
Jerks.
you and the horse, Kathy
it-
T's cool, but you're an asshole.
Z, would you ever get a gun?
Would I ever get a gun?
For home defense or for concealed carry?
Or for fun.
I would get a gun for fun. That's what I would get a gun
Yeah.
for. Because for me, I'll tell you why, Kathy. And again, this is a comment. I actually consider it, Tom, very similar to the vegan argument, which we can talk about.
Yeah.
I feel like there is so much suspicion and badness in the world that I will have to personally take it on myself to try my own piece to say, you know what, I'm not going to have a gun even if I feel threatened, because I would probably rather go out like a sucker and die than have to worry and carry a gun like that. Now, that doesn't mean I don't like guns in the sense
Right.
of for fun, so I would
Right.
use it for that. So that's just me.
Right.
But what about
And I think
when you
it's
got to defend your
personal
family,
preference.
Z?
Yeah,
you got to
Z.
defend your family.
So I don't actually trust my ability to defend my family with a gun. I would be
Yeah.
more concerned that in a fit of pique, I would end up accidentally shooting someone or myself.
Stop being rational, Z.
But
And
you
I'm
know,
not carrying a gun everywhere.
Right.
I mean, I'm not carrying it in the community. But, again, like the first tenet they tell you of having a gun is that you're not a police officer. You're not there to protect everyone. This is self-defense.
Right.
And if you can get the hell out of there, get the hell out of there.
right. And I'll be honest with you, the fact that Logan has a gun makes me feel better.
Yeah,
Because-
you just have someone else care
right.
for you. It's
Because
fantastic.
exactly,
It's
how
like
about someone else do the dirty ethical work?
You don't pay anything for a security guard here.
Exactly.
Well,
Well, I
the-
mean, I
Logan?
pay in blood.
Aren't the guidelines for a mass shooting still? It's run, hide, fight in that order. So you're supposed to run first, then hide. If you
Yes.
can't run, then fight
Yeah.
as your last resort.
Exactly,
So
exactly.
I'm glad you mentioned that, Tom, because
I think that's in here.
Table 6 or 7
Table
here is best practices. Now this is hilarious. It's like they have these very staid best practices for active shooters. And they have.
Well, they classify everything, which is a little lame.
So this is okay. You got.
Tier 1.
Stick with me for a second. There are
Sorry.
different types of violence. So apparently, there's type 1 violence
Yes.
in workplace. And that is violent acts by criminals who have no legitimate connection with the workplace. So it's as if a criminal came into your office and was like, give me all your money. I don't know who the hell you are. I just want your money.
Right.
That's type 1 workplace violence.
Which is probably 0%.
0%
Yeah.
in healthcare.
In healthcare.
It rarely
In healthcare,
happens.
yeah.
Rarely happens.
Yep.
Type 2 workplace violence includes any violent acts directed at workers by patients, clients, students, inmates, anybody else you're taking care of. So that's probably the majority of healthcare
Yeah.
worker violence.
Yeah.
Type 3 is aggression against coworkers, managers, supervisors, or employees by a present or former employee of the organization. So that would be like if Tom sucker punches Logan right now,
Do
or,
it.
Yeah, and then Logan shoots him.
Oh.
And then Logan shoots him. So that's type 3, and type 4 is violence in the workplace by someone who doesn't work there, but is maybe a relative or affiliated, and comes to shoot
yeah.
a coworker, or I'm sorry, a wife.
domestic
or
abuse,
Domestic abuse, but
basically.
that happens at the workplace of this person's
Yeah.
workplace. So, all right. So that being said, it's kind of funny that you have to actually, and this is an FBI classification.
Yeah, it is.
So
It
there
is.
you have it. And then
They probably do it for statistics.
Probably, because they have
Yeah.
to classify.
Yeah.
And also when they're filing the complaints and doing this and that,
Yeah.
they probably have. So table 2, they talk about what are the causes of violence. And I thought this was interesting because it kind of sums up some of this stuff. So receipt of a poor prognosis, imposing of physical limitations like you can't drive. You're having seizures. I'm going to tell the DMV. You can imagine patients who've been free all their lives and value their freedom are now getting violent.
Yeah.
Right? Or giving bad news to emotionally unstable patients or those without sufficient coping mechanisms. So that's
I
one.
think that's the biggest one. Like
Right.
the number 1 was the biggest one.
Right. And number 2 is dealing with patients and clients who suffer from behavioral disorders or who are under the influence of alcohol, medications, or controlled substances. So people who
Oh,
are
yeah.
on drugs or alcohol or have psychiatric disorders. I think that happens a lot in the hospital and in family members who come to the hospital.
Yeah.
And then you have the denial of narcotics or controlled substance prescription demands, or refusal to categorize a client's diagnosis based on their request because of disability claims, insurance reimbursement, or other illegitimate
Yes.
purposes.
And that was my first experience in medical school. I was rotating in an outpatient clinic. It was PM&R, and they were doing workers' comp, and people would threaten to shoot them if they didn't fill out their workers' comp paperwork. And that was my first experience with violence of this type. And I thought, I'm never doing workers' comp. I'm out of here.
Right? You're
Bye.
done. You know what's funny? My dad in his retirement does disability evaluations. So he works
How many
for-
times has he been threatened?
He has yet to be threatened, but he said patients get angry.
Yeah.
And
Because he's so nice.
He's an old
Yeah.
dude who's got
Yeah.
a lot of kyphosis, and I
Yeah.
doubt they're going to physically threaten him,
Yeah.
but they definitely verbally escalate. The other thing is my dad's pretty nice to them, so
Yeah.
he does it in a way. that-
Okay, I'll give you
I'm
an extra
telling you.
month.
You don't need to go on this.
You look great.
I'm looking at you now, buddy. I see you, okay? By Vishnu, I'm telling you. He doesn't even, it's not even Hindu. On and on and on. And so, but it does, part of me gets worried about it because that is a piece of it. And then misplaced blame for financial situation resulting from charges incurred for medical treatment. So you had mentioned patients who don't pay their bills.
Yeah.
Now, some people mistakenly or true, will blame the doctor for their big hospital bill or something like that.
Well, that's the hospital.
And that's the hospital, but
Yeah.
they'll come and blame whoever they can find.
Yeah, yeah. And people sometimes, I think, get angry. Whoever is right there, they get mad right there at that person, and it's not necessarily directed at where it's coming from.
Yeah.
So you get the brunt of that.
Yeah, yeah. Well, and then it gets real interesting. So they start to talk about behaviors of concern for potential violence from coworkers. So what should be a flag that Logan's about to use that weapon on me? The eyes. I'm gonna say the eyes give it away. Those are crazy eyes.
Yeah.
I'd say
red
crazy eyes.
flush. I've not ever seen any of these signs.
So look at these
which
signs.
is
They're kind of
good.
ridiculous.
They're a little crazy. Yeah. A
So
little over the top.
if Kathy's drinking more, increased alcohol or drug use, you worry about that. Unexplained increase in absenteeism. I mean, that's basically my whole crew.
Yeah.
Vague physical symptoms. I don't feel good. I'm not coming in today.
Yeah.
Noticeable decrease in attention and appearance and personal hygiene.
Oof.
That'd be-
Is that Logan over
That
there?
would be a Tom.
Tom.
Shit.
Smell amazing. guys. Zach's body.
We all know it's Tom.
Depression, withdrawal, or severe mood swings. That's me. Resistance or overreaction to changes in procedures. So, hey, we're going to move the table. No, you're not! That's me. Repeated violations of work policies. Well, that's all of us. And fascination with weapons or acts of violence. That's these two. So, pretty much, these are not very reliable.
Yeah, no.
Yeah.
No. I mean, I'd love to see the specificity of that.
Yes. They're neither
is
sensitive
like,
nor
no,
specific.
no.
Table 4, physical signs of potentially violent individual. A flushed face. You mean like this?
I don't know if that was flush so much
What
as
if I
just
just
like
gave
crazy
him a steroid
eyes.
dose
you know?
pack? Like, it's all relative to what's going on. I mean,
Right.
you can have a flushed face from just getting steroids. I give a lot of steroids.
Hell yeah, some people have mast cell disorder.
Yeah,
Some people
exactly.
just blush.
Yeah,
so
allergic reaction.
that's
I
not
mean,
very
no.
sensitive or specific.
No.
Hand waving and finger pointing. I am a little intimidated by that.
Yeah.
All right, that I'll give it. Direct or prolonged eye contact.
I'm like, I'm not gonna let go. I'm not gonna let go.
I couldn't take it. It was too much for me. And the person moves into your personal space closer than 3 feet in the U.S. I love that they clarify the U.S. So 3 feet, we're already there.
Yeah.
So
I feel pretty violated right now.
I have been violated since this thing started.
I like that they have to clarify the U.S. because other cultures do not have the same stipulation on personal space. You know what I'm saying?
No,
Yeah.
it's totally true. It's like
Oh no, watch your.
it's like this. Hello, Tamanabo. How are you? I am French.
I know
This is how we
French.
do it in France. It's wonderful. Are you wonderful too? I am wonderful.
Why are you so good at that?
I feel so violated, man.
Tom was
Pepe Le
legit
Pew over here in
uncomfortable,
my
man.
ear.
He was legit uncomfortable. Like
Got
I
a
was
little
afraid.
red in the face
I was
there. He
afraid-
was flush
He
face.
was flush face.
Flush face.
He had crazy eyes.
About ready to pull Logan's gun out of here.
So I mean, we make fun of this stuff and we're joking, we're having a good time, but like they're trying.
Yeah.
I
Yeah.
don't know how useful this stuff is. I think we could
Yeah.
be better trained. The question of concealed carry and guns, I think if you feel safe and you're well trained, then more power to you. And I think we want everybody to be safe and our patients to be safe.
Right, and I think the two most important things, besides teaching your staff and also learning about de-escalation techniques on how to bring someone down, I think I just lost my train of thought.
I do that routinely. I'm glad it wasn't just me. It's
Anybody-
like late. You've been seeing patients.
Patient expectations.
Yes.
Patient expectations. Okay, so when we schedule a new patient appointment, it is communicated to them, one, that I may not write them opiates on the first visit.
You
It
tell them that
depends.
up front.
Up front, they
Up
know
front.
exactly what the rules are.
Yeah.
I may or may not prescribe them. I may or may not think they're indicated.
Yeah.
They need to understand that if they're coming here expecting that,
Yeah.
that they should not expect that.
Yeah.
On the front line, have your staff really set the expectation before they even walk in the front door, if you can do that.
So first of all, I think that's great. And I think a lot of people don't do that
Yeah.
effectively. And in this town, there's a lot of, and in other towns, there's a lot of pill mill activity,
Yep.
a lot of really kind of shady
Right.
stuff going on.
And that hurts. That hurts not only the physicians, but the chronic pain patients who do have pain that are on some type of opiate that benefit from it. They're working, they're doing, they're living their life.
And for those of you who want to hear Kathy talk about opioids, go back to our show, You Get Dilaudid, Everybody Gets Dilaudid. It was an episode of Against Medical Advice where Kathy talked about her philosophy on pain management. I thought it was very, very helpful. A lot of people really enjoyed getting your perspective on that because it's a huge problem in this country, as you know better than anybody. You actively chose to take care of this problem as a doctor because you were a personal trainer before that. Then you went into physical med and rehab, and then you got into pain at exactly the time when everything's going shitstorm crazy.
Yeah.
So clearly you care, you're passionate about this stuff, or you wouldn't do it.
Yeah.
And so we have to support people like you that are actually trying to help.
Try not to shoot me, please.
Yeah, in other words, don't shoot
Don't
Kathy.
shoot me. Don't shoot me.
If you're cutting to the chase of what I'm trying to say, don't
Yeah.
shoot
No
Kathy.
shooting.
Don't shoot anybody. There were some de-escalation strategies. Tom, should I go through them real quick? Or
Boring.
Screw it.
Shoot everybody.
Read me some comments.
Just kill them all, Z.
Kill them all,
Kill 'em,
Z.
just boom.
I'm wondering
Let
what
God
people
sort
think
'em out.
about physicians caring and what what people watching think about that.
We're going to find out right now.
If you shoot somebody, do you have to treat them immediately?
Oh,
That is a good
That's a
point.
really good question.
I don't know.
Do no harm.
Yeah.
Do no violence.
Okay, I don't know. I
Well,
don't know.
What would you do?
If they were fully disarmed and they were just
Well, I probably wouldn't stick around to see if I killed
Bleeding
them.
it.
I'd probably shoot and then run the hell
Run
out
the
of there
hell
and
away,
call
right.
911 or call
Right.
the police. So I
Right.
wouldn't go there, check a pulse, and start doing I wouldn't go in there because
Right.
you don't really know. I mean, I'm sure that there's such heightened anxiety and tension that you just want to. I mean, the point of shooting someone when they're going to attack you or kill you is
Stop
you
them.
kill them.
Stop them.
So.
And that's the other thing. So
shoot, peace out. I'm out of there.
One of the great mistakes and misunderstandings in the defense space is people say, well, why couldn't the police officer have shot them in the leg? Why couldn't the?
Because it's very highly they'll miss.
It's
The miss rate is huge.
impossible to do.
And you're trying to immobilize the person
Right.
from
Yeah.
shooting
Right.
you. If
Shooting
you
him in the
get
leg's
shot
not
in the
gonna do
leg, your
anything.
hand's still available
Yeah.
to shoot back.
He is threatening your life.
Yeah.
You need to stop that person.
Right, right.
He or she.
Yeah.
And so that's one thing that I think a lot of people who don't understand the gun dynamic go, oh, just why couldn't you use a stun gun, or why couldn't you do X, Y, or Z? And
Yeah.
the thing is, sometimes you do need a lethal or the most aggressive stopping mechanism that you have.
Right.
And so you know.
And I don't expect to ever use this or shoot anyone. I don't think it's going to happen, but I want to be prepared.
Absolutely, yeah. And I know a lot of docs, and I know a lot of nurses in this town who carry. And Vegas is
It's Nevada.
It's Nevada.
It's Nevada.
It's a very libertarian state
Yeah.
where people want, and also we have a very high crime rate. We have a very high opioid addiction rate. And so it's not statistically entirely unjustified, although I'm more likely to hurt myself with the gun, probably myself.
And
as a male.
I think it's important to know that you have insight.
Yeah.
And I think, people that shouldn't have guns, hopefully they have insight that they shouldn't be carrying.
Some people don't.
But some people don't.
Some people don't.
Yeah.
Shedrick says, question, is having a strong male presence on the floor helpful or a deterrent? I was constantly called to be the 6 foot, 230-pound black man.
Man, we all need a 6 foot, 230-pound black man.
Yeah,
just
I would
hanging
like
around.
to have that at my office for security.
Yeah.
Yeah, I would. I think, compared to a 5 foot, 100-pound Asian woman, I think you win.
Let's not be racist here, Kathy. Everyone's the same
no, here
about
we go.
physical violence.
That's just her staff, man. She was talking about me, Tom. So.
Okay, so reason why I said that, just in defense, I have a very small Asian patient today. It was very, very small, and so I thought of her. I would rather have him than her at
as
my
far as a
office
deterrent,
in terms of security.
Of course, she probably knows.
Unless she knows some
crazy,
MMA, and she'll,
right,
totally,
MMA type
yeah.
because of Vegas.
Yeah,
Yeah.
and he's so big he can't
So
move.
he can't move, right? I have
Okay, it's all relative,
I have
whatever.
an inflatable large man that I ride around with just to keep me safe, and also allow me to use the HOV lane. and
People do that.
I was going to make a very.
Don't say the last thing.
I'm
Don't
not
say the
going to
last
say
thing.
what I was going to think. Yeah, never mind.
He's going to make a sex doll joke, everybody. All right,
No, I
said it.
wasn't.
I said it.
I was going to make a racial profiling joke, but I decided to back off it because I like to keep my job, whatever that is. So that being said, are there other comments, Tom, that need emergent addressing?
I think we can wrap up.
Yeah.
Get a gun, kill some people, do no harm.
America.
It's a paradox, but it's what you got to do. So.
I hate you so much, Tom Heineberg, and yet I choose actively every day to come and spend time with you and create things. By the way, speaking of things, we did an interview with a 6'4" male nurse who was attacked in the ER by a woman who was on a psych hold. And she nearly killed him by choking him. Well, no, I'm not going to say. You guys have to see it. It's on YouTube. I'm going to put it on Facebook tomorrow morning.
Okay.
So tune in tomorrow morning.
I'll have to
for
watch that, yeah.
It's really good. His story is really,
Yeah.
you just go, wow. And what's worse is what happens afterwards. So that being said, Kathy T, any words of wisdom for the crew, and especially our chronic pain patients, who many of whom are fans of the show, any hope and wisdom for them in their suffering?
Oh gosh.
It's a long
I was
slog.
not prepared for that to answer that question today. Don't shoot your doctor. Try to work with them, and I don't know. What do you have?
Have hope.
Have hope.
People
Yeah.
care. They care about your suffering.
Yeah,
We try our
absolutely.
best. And people like Kathy are designed. They're trained to help you. So we're not abandoning you just because we talk
Right.
smack about opioids.
Listen, throw out the drugs, you guys. Put them in your mailbox. Send them to me. My home address is.
Sell them and buy guns.
I don't know why I do this. You know, like, we're doctors. Like,
I know.
We don't have to do this. We can go see patients all day. You did.
No,
You did
yeah,
that,
but I'm tired.
You're tired, but
Yeah.
I'm tired too.
I know. I look tired. I'm sure.
No, you look great, but I'm more tired dealing with these two clowns. It's
Yeah.
like all day.
That's
every
like
day.
babysitting.
It's like, literally, they're like, hey, take a look at this video right here. All the kids are watching this. And it's like the worst kind of, you're just like, this is horrible. Like, what happened to music? I mean, what, huh? Is this on still? What's going on?
Z, is it every day?
It's every day, bro. It's every
Day,
day,
bro.
bro. This show's off the rails.
It's the Disney Channel flow. All right, guys, we're out. Kathy T, thank you.
Of course.
Always
Always
a
fun.
pleasure. Thank you for
Always
coming
fun.
by. And we out.
Go, go, go.
Fun.
It is always fun with Kathy T, God damn it. Oh, what? It's still on. Hey!
Communism is evil.